Hello, everyone. My name is Yvette Cozier, Associate Dean for Diversity, Equity, Inclusion, and Justice at Boston University School of Public Health. Thank you for joining us for this Public Health Conversation Starter. Today's conversation is part of our SPH Reads series. SPH Reads is a school-wide reading program hosted by the Office of Diversity, Equity, Inclusion, and Justice. It aims to encourage critical thought and discussion among all members of the BUSPH community and is centered on a carefully chosen, thought-provoking book. The selection for the 2025-2026 academic year is Ripples of Hope in the Mississippi Delta, Charting the Health Equity Policy Agenda, written by David K. Jones and edited by Deborah Bingham, Nicole Huberfeld, and Sarah Gordon. Today, I have the privilege of speaking with L Nicole Stringfellow, who is a distinguished and multifaceted professional with 30 years of experience in community and economic development, complemented by 26 years in program management and solutions development. With 18 years as an adult educator and knowledge coach, she is an expert in grassroots community engagement, data-driven programming, leadership development, compliance, nonprofit capacity building, and fostering impactful initiatives. As the CEO and founder of Fabric Incorporated, since 2016, she has led this 501c3 nonprofit dedicated to community empowerment in the Delta region. Additionally, through Stringfellow Strategic Solutions, LLC, she specializes in managing coordination for meaningful events and provides expert consulting in strategy and program development. Her international mission work spans Puerto Rico, Cuba, and South Africa, alongside policy advocacy with the American Heart Association and public health research in the Mississippi Delta. She is a visionary leader committed to justice, education, and sustainable change. Linda is honored to be a member of Delta Sigma Theta sorority and the Lynx Inc., embodying a lifelong commitment to service, leadership, and community impact. Thank you for being with us today, Linda.
Thank you for inviting me.
Sure, and I just want to say, by way of putting it out there, my grandmother is a Delta as well. So, okay, so so can you please start off by sharing a bit about how you came to be doing the work you're doing? What motivated you to start Fabric Incorporated, and how did the organization come to life?
Oh my goodness, I don't want to date myself, but actually what got me started in the work that I'm doing is national service. I used to be an AmeriCorps member, and then once I completed my term, then a second term, I was hired by a local university to be a staff with their AmeriCorps program, and then we started AmeriCorps Vista program that lasted 15 years. So service has always been in me. As far as starting Fabric, I started Fabric for two reasons. Are we telling the truth, the whole truth today?
We are.
Okay, the whole truth of starting Fabric is because I got mad at my employer because there were some things that I wanted, that I have a passion for, and I wanted to do something. And so I pitched ideas to the organization at the university I used to work for. And they were like, no, that is not the direction that we want to go in. And I offered others, and they were like, no, which I understood, but I still didn't like. So I was like, no, I'm going to start my own. And I stayed up all night one night and wrote the articles of incorporated, and picked some friends and say, are you all willing to be board members for this incorporated? And it just went from there. And then when my mom died, I said, I need to find a way to honor her. So I started a scholarship fund. And with that scholarship fund, I said, I need to have a legal way to make sure that we're able to receive and track donations and provide support back to individuals that contribute. So I was like, okay, the nonprofit will serve this capacity and that capacity. And that happened in 2016. So yes.
Wow. And does Fabric, is that an acronym for anything, or why the name?
The name Fabric It is an acronym. It's pretty much a process that people go through for growth, individual growth, and also pertaining to the social fabric of society. It takes all pieces of society to come together, and we have to support each other for it to be better and stronger. Um, but the word just fabric just kept coming to me, fabric, 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 but not it as an acronym, just fabric. And kept researching why the word fabric, and it was like, ah, the social fabric. I understand that part. And then when I got into it a little bit more, it was like, okay, it's a process. So
Love that. Thank you. Um,
thank you.
so in what ways do you see Fabric's mission and work impact the communities that you serve?
In the beginning, being completely transparent, I did not even see impact. I just knew that I had a passion and I wanted to honor my mother and I needed to do something legally. And so we started the nonprofit. It took probably the first year to get the mission and the vision. But once I had an organization to help me get the mission and the vision, it was like, yes, this is you, Linda. This describes you. You are about helping the people. You are also about the people being able to sustain and help themselves as well as grow. Um, and we just built it from there. My passion, because I've had 30 years in HIV work. And can you believe it? 30 years, and I'm only 39 years old. But can you believe 30 years in HIV work, prevention and awareness? And so I had a heavy passion. I wanted communities to really understand about HIV. And this was 30 years ago. And so when we got to that point, it's like, okay, now this is your strengthening. That's where our first grant came from was Gilead Compass funding that helped us do our prevention and outreach work. And then it was like, okay, now you're going to start giving your scholarships. And it was actually during the pandemic, the first part of the pandemic, where we finally got enough funds, a couple of $1,000s, to give two young ladies scholarships. And so I was like, wait, from 2016 to 2018, 19, we're finally at a point to get to this because I just knew it was going to flourish overnight, but it didn't. But I had to continue to feed my passion, but I had to have more structure to it. I hope that answered your question.
No, absolutely. And for the past 30 years now, looking forward, what are your priorities and hopes for Fabric and the Mississippi Delta in the coming years?
Okay, my priorities for fabric also aligns with what I really want to see the organization do for the Mississippi Delta. Is the priorities of fabric for two. When I was working with Together for Hope, that introduced me to faith-based communities and institutions of faith. And when we're talking about HIV, anything dealing with sexual and reproductive health, there's a stigma associated with it. So I want to definitely be able to grow our Know Us campaign where we are working with more faith leaders and we're buying items to help reduce some of the stigma associated with anything that has to do with sexual and reproductive health. And also Your Voice Zone. That is the newest, and I want to see Your Voice Zone become we have two cohorts a year, and Your Voice Zone is where young adults age 18 to 30 sit-ins, we create spaces for them to discuss issues and also discuss or learn how those issues impact them and what can be done to lower the impact as well as getting more involved with government, being considered for running for elected or appointed position later on in life, but understanding your grooming starts now if you want to see something happen better down the road, and understanding policy and advocacy work in a calm and dignified and organized way. And for the Delta overall, I want to see the Delta. I love working with women, women of all ages, race. I love working with women, and I like to see women be more self-sustaining, whether you're with someone or not, but also properly equipping yourself with the tools as well as understanding the mental health components of all of it. And with our young adults, especially college students, understanding about mental health is important and helping them work through those stages of peer pressure, not only from their students that are with them, but also from parents and loved ones, and put timelines on their lives. So I want to see people really fill up their toolbox and use it. That's the other part. And use it. Don't just fill it up. Use the toolbox.
Good point. Very good point. I'm going to change directions just a little bit and ask you personally, who are some of your mentors and role models, and how have they helped to shape your journey?
Of course, my mother was my first and my biggest role model, even to this day. My mother got me into adult education even before I finished junior high school because she was an educator and she taught GED classes at night. So of course, you're the youngest child, so you have to go where she goes. So I was semi teaching GED classes at an early age. And so my mother, there is my aunt, a retired immigration attorney. She just her wanting me to learn more about other cultures and other way of life. Yes, I live in the Mississippi Delta, but there's a whole big world out there. And she got me interested in international things, especially international travel, and also being a businesswoman. My mother and my aunt were businesswomen. And another one of my mentors is, excuse me, of course, Maya Angelou. Just her language and her demeanor and her poise and her grace definitely has stuck with me. And there are a couple of more that are, one is the international president of an organization, and one is also a member of an organization that just has been teaching me how to embrace life, slow down, truly understand what it means to get rest. And also that has been teaching me retail therapy does nothing but burn your money up. So,
That's a good one. So again, now switching focus more to the book. Um, you had the privilege of working with the late Professor David Jones, who wrote this book. Did your work with him influence any aspects of your current work? And if
oh,
so, how?
oh my God, yes. Working with David was a joy. When he first reached out to me, it was very interesting. I was very hesitant, I must be honest. And it was, okay, here we are. Is this another northerner? Want to come into the Delta, want to collect information. And so we actually went through this back and forth, smooth communication, but we were really trying to get a feel of one another. And working with David changed my life. David taught me photo voice. And for those that are not familiar, photo voice is a research option that some use where a topic is given to you or you're provided research. You research, you do the manual research, but in order to really use photo voice, you have to take pictures. So we would have I would organize small community groups. And I would say, this is your chance to talk to us about public health, education, infrastructure. And they would have to come back with photos. They could not talk in their presentations. The photos had to reflect what their perspective was pertaining to those topics. And it was amazing. And to see people from the community that is so accustomed to people coming in, give them a sheet of paper, tell us your name, age, blood type, how many hairs on the top of your head, all of this data. But at the same time, it doesn't give them a voice. It's just taking them through a collection information activity. And when the people from the community saw, this is my picture. This is my perspective. And then we even had it to get bigger here in Cleveland, where on the campus of Delta State, they let us use a room, and so we opened it to the public so the public can see their photos. And it was amazing. And we also did the same thing in Montgomery, Alabama. And it was just beautiful, just being able to see, and people saw they may not have opened their mouth, but they are showing their voice, or their voice is being heard, and they're painting the particular topic according to their perspective. That means a lot, because usually we have individuals coming in from other areas, and they collect all of this information, data, but they still go back and write the narrative and paint the picture according to their perspective. And so that's disrespectful to the people that you just collect data from. So yes, David's concept taught me a lot, and it helped me change the way that I did things in my former employment, and even with my nonprofit now, even with the LLC. I use the concept, we want to hear the voice of the people, and there are multiple ways to be able to hear the voice of the people and have them feel comfortable. And working with smaller groups instead of 25, 30, or more people, just because you're trying to collect a lot of data in a short period of time. So he helped transform the way that I serve communities.
It's great. Um, so looking now at the current time, and the challenges, how do you stay grounded and motivated as we face these challenges and new federal uncertainty in many areas? Has that altered your practice in public health in any way?
Now, in complete honesty, at first, this has been a complicated year, calendar year. To this point, where as of right now, we have not received any funding this year, no contracts this year. And I stressed myself into a stroke the end of May, the beginning of June, physically into a mini stroke.
Mhm.
Um, I'm recovering. And at the same time, we're reevaluating. Well, we've already reevaluated the three type of initiatives we had taking place, and we're having to put a pause on two of them. And one, we're looking at the one that costs the least, and that is our Your Voice Zone, working with our young adults, especially college students, on how to use their voice and understanding and preparing them to be future leaders. But it was hard to choose between the two, well, between the three, because the other two we gave provided many grants to faith-based institutions and churches to help them strengthen their health ministries. We would give them 1,000, 2,000, or $3,000, and so that they can add more, how would you say, stronger programming with their health ministries and outreach pertaining to certain public health issues, not just sexual and reproductive health. We're talking about high blood pressure, cardiovascular, definitely diabetes, because Mississippi is a number one amputee state. So it was hard to decide, but right now we're slowing down and we're working with Your Voice Zone, but it is definitely the goal or aspiration that funding does start coming in, we get donations coming in, so that we can continue to support our faith base and our young adults. But we've had to shift, we've had to pivot, and we've had to pivot hard. But even during this recovery, for me personally, can't stop. I can rest, but I cannot stop, because we just have to get our people on the other side. And how can we teach or provide guidance on sustainability when we don't focus on sustainability and put it in practices ourselves?
Yeah. Yeah. Um, and just thinking about our students, what advice would you have for current public health students, or even those who will just be starting on their journey? They might be interested in getting involved in community-centered work. What would you tell them?
Okay, is this all level public health students?
All levels.
Oh, okay. My more mature me would definitely tell students, yeah, I'm just gonna speak it as is. As you pursue your degree, certification degree, out of all the research that you may do, remember that is people. They're not objects, not study objects, they're people. Get to know the people. I'm an academia in a lot of aspects of my life. Getting your degree, beautiful seeing the letters behind your name, but at the same time, please try not to pursue your degree in a selfish kind of way. Oh, I'm just going to get this information, get my degree, and that's done. No, that is what we call raping communities, because you're coming in and raping and stripping them of some dignity, some pride, stripping them and raping them of data, but at the same time, nothing is being given back. And you're also causing communities to relive trauma, because trauma, we'll call it trauma informed research. Trauma is a real thing. And having people to sit down and discuss or want to come into their homes and take pictures, that's causing them to revisit the realities of where their life is or what has happened. And on some more positive sides, all that you do in your research, let that be your launching pad into service. Let your research have a passion to it for yourself. If you want to learn more about heart conditions, high blood pressure, let it be a launching pad. Are you going to use that to create some type of initiative and work with a nonprofit organization to launch that initiative? Are you going to create some kind of solution driven curriculum to go along with that research? Don't just start with the research, data collection, have the degree. Take it a little further and add some implementation and some action into it, because now that's your baby and you're going to want to nurture and take care of your baby. Before you go into any community, I'll also say get connected to the community. Seek out research who are the true doers in the community. And it's not about who has the biggest name, it's who's doing the true work and who the people respects. Because when you want to get into communities, especially with health conditions or diagnosis, people are very secretive. They're not dumb, but they're just very secretive and they're very limited with what they want to tell, because now the trust in communities, especially grassroots communities, has escalated tenfold. So anybody that's coming in, let alone people that already stay there, what do you want this information for? How are you going to use it? And don't come in with the gift card coercion method. The gift card coercion method, if that gift card is not $200 or more Visa, where I can use it to paying my bills and everything, the $25 Subway or whatever coupon, and no discredit to any of those companies, those don't work. Those are persuasion tools that really aren't beneficial. They're almost an insult. And understand, every student, you have the power in your hand to make a difference. You have a big power and a big responsibility in your hands to make a difference. It's not the pace of the degree that you obtain, it's the quality and your emergence in that degree, and how you obtaining your degree will make an impact in other places. And that's a part of building your legacy.
Wow, that is great advice. Definitely good advice. My last question, again, referring to the book, um, David Jones really begins the book by saying he believes that health equity is possible. Do you believe that as well?
I believe health equity is possible when we all put in true energy and effort to be concerned about others, from policy to implementation, advocacy, even to service and access to care. It can, it is possible. We just have to care as a collective and be, what is it? Be intentional about making a difference.
Wow. Linda, thank you so very much for your time today, for sharing the wonderful things that your organization is doing, your perspective, and mostly we wish you continued health and recovery, and really appreciate all that you've done. Thank you so very much.
Thank you. Good to meet you.
Same here. Same here.